Hi, my name is Elizabeth Yu. I'm from Virginia Eye Consultants in Virginia, and I have with me the Dr. Juan Batlle of the Laser Center from Santo Domingo. And today we want to kind of just share our pearls with you as it relates to customizing and personalizing the process of cataract surgery and the actual patient journey, because as we know now with the options that we have today, it really is different because we can offer our patients more, and what it really requires for us and for the doctors is to understand our patients better. So Dr. Batlle, when you have a cataract surgery patient that's coming through, what does that cataract surgery evaluation look like? Do they go through a counselor? How is that process for you at the Laser Center?
Thank you, Elizabeth. I guess the most important message to get across is that cataract surgery today is not like cataract surgery years ago, where we were out there to just make a beautiful operation and remove the lens, substituting it with an intraocular lens that was more or less accurate to within 1.5 diopters. Our expectations, or our patients' expectations nowadays, are totally different. They want to see at distance, intermediate, and near. They do not want to wear eyeglasses, and that expectation, that threshold, has been risen to a point where we have to be a lot more precise, a lot more accurate, and then we have to communicate very well what we are able to do and what we can satisfy in their expectations and what we are not able to do.
Absolutely, and I think that in the last 5 years in particular, in the United States, presbyopia correcting lenses was really stagnant, and it was only comprising maybe 5 to 6%. In the last 3 years, it really has risen to closer to 8%. It doesn't seem like a lot, but that's a pretty big jump. And I believe that part of that is because, one, the expanse of lens options, but the quality of lens options. So now we know that at least the technology that we have available to our patients is there to provide that high quality vision. And obviously us being passionate about that makes a big difference, because that comes out in the education process as we're talking with our patients about it. So when we're looking at our patients, I do look at what their near vision needs actually are. Objectively, I have a counselor who actually scribbles down and writes some of this information. If they're using the computer hours a day versus reading versus doing needlepoint, I actually go so far as to find out their height, and then beyond their profession, what hobbies they do. And that information is given to me. I review that as well as their measurements with the topography and lensor before I speak with them. So let's say, Dr. Batlle, you have a patient who is a 65-year-old administrative assistant, loves to read, is thinking about retiring, but her passion in life really is going to be reading, and she's only about 5'1", has a healthy macula. What does that conversation look like when you are talking to her about her and her options?
So immediately, and it has to do with the exchange, the conversation, the sharing of her feelings with my knowledge about what I can offer. And I look for details about their lifestyle, meaning, as you said, what they spend most of their time doing. For example, as a doctor, I'm an intermediate person. My records are on the desk. My computer laptop is at a 40 centimeter distance. Most doctors do things at an intermediate distance. My speedometer is at an intermediate distance. I do have to see at distance, but I really don't need to see things up close. The patient you mentioned is short in stature, meaning short arms, likes to read a lot. So obviously, she's working at a 25 centimeter distance. And for her, that has a priority.
Yes.
So I have to adjust my recommendations to her needs.
Right. Do you, in that conversation piece, how do you coin or discuss the benefits as well as maybe the potential concerns of dysphotopsias? How do you address that with the patient?
So many of the things have to do with the questioning that comes in the questionnaire that you mentioned. Night driving is a big deal, because
yes,
you know that there will be dysphotopsias when they drive at night.
Right.
And although they do disappear, it may come, say if it's a truck driver or somebody who makes a living driving at night, it would be a major consideration and an objection to having this sort of platform recommended. However, if they hardly ever drive at night, or they have a driver or their husband is driving for them, then it's not such a major issue, knowing that it will disappear in time.
Right.
The next thing is that before I make a recommendation, I have to thoroughly study the ocular surface, their macula, all those things that may actually complicate the eventual result and not give us that perfect high definition 20 result that we're looking for. And I know we discussed this before, but yes, premium patients need to get an OCT of the macula. We do specular microscopy looking for fuchs dystrophy. We carefully examine the anterior segment for pseudoexfoliation, for scars, for previous surgery and the like. And only then do we decide as to whether they are to receive a premium lens or not.
And that personalization is really the perfect word for what we're doing, because it's not just for all patients. It really is an individualized plan that we create as partners in that professional relationship with the surgeon, as well as each individual patient and their specific needs. And certainly we have the passion because we know that the technology already can perform and can meet and exceed patient expectations. Certainly, yes, with any kind of light manipulating technology, there are going to be the side effects, but to actually be very real about it, but mentioning that it's non-disruptive, it does decrease in time, and it's really only more significant in less than 2% of patients, and that we have a plan of action in place if we need to address that. That whole being there for them from start to finish, I think, is such an important part of the cataract surgery patient's journey.
And also, and this is from the Refractive Surgery Alliance that Dr. Guy Kazarian has emphasized so much, our mindset has to be towards phaco-refractive surgery. It is no longer just cataract surgery. The refractive result has a top priority nowadays that it didn't used to have, but I guess if we don't satisfy that need, we're not going to be successful. The most successful surgeons like you take the time to discuss issues like this with their patient and then look at the numbers, look at the data, and choose the right platform for their patient. That's the key to success.
That's right. And ultimately, we really can make some of the happiest patients by giving them that freedom and meeting them in their needs. So thank you very much for spending time with us, with Dr. Batlle and myself.